Did you know that approximately 6.4% of college students aged 18 to 22 misuse Adderall? Hi, my name is Jacob Strong, and today I wanted to talk to the class about the purpose of Adderall and why it is misused among college students. By the end of the presentation, you will find out whether those who use Adderall illicitly are doing so for real benefits, or if their illegal use of Adderall is in vain. So today, the objective and overview is what is Adderall, Adderall's intended use, and Adderall and why it is controversial. Okay. So what is Adderall? Adderall contains a combination of amphetamine and dextroamphetamine. And Adderall may cause heart attacks, strokes, and sudden death in people with high blood pressure, heart disease, or heart defects. So Adderall is a central nervous system stimulant. Adderall is a controlled substance, so it cannot be purchased over the counter. This is because it has the potential for abuse. And some other examples of stimulants are cocaine, methamphetamine, caffeine, and tobacco. So Adderall is used in the treatment of ADHD, ADD, and narcolepsy. And then another statistic. So students frequently cited unpleasant side effects, which include a loss of appetite, mood swings, sleep disruption, jitteriness, loss of sociability during usage, and crash-like fatigue following usage. So this is important because it gives people knows what their kids might feel when they decide that they have ADHD or narcolepsy and they need to treat it. So Adderall's intended use. So ADHD has become the most commonly diagnosed psychiatric disorder among school children. So Adderall is not a cure for ADHD. It's a temporary fix for the symptoms caused by ADHD. And ADHD has other alternatives. One alternative is antidepressants. However, antidepressants take weeks to work rather than hours like Adderall does. So its intended use continued. So a psychostimulant drug that helps increase the amount of dopamine or norepinephrine in the brain. So because of this, rather than calming the person down, the affected client is simply better able to focus his or her energy, concentrate and reduce attention to extraneous stimuli. So stimulants are typically the first line of medication treatment for ADHD, given their extremely high positive response rates, 75 to 80% among children, in treating the symptoms of ADHD. So those with ADHD have symptoms of hyperactivity, and this keeping consistent amounts of attention in normal tasks, and has excess amounts of anxiety. Adderall is an amphetamine and dextroamphetamine, and both of these are central nervous system stimulants that, when combined together, fight the symptoms of ADHD. Even though it is a stimulant, it does the opposite for those with ADHD or ADD. So Adderall is not a cure for ADHD. It is a temporary fix for the symptoms caused by ADHD. ADHD has other alternatives. One alternative is antidepressants. However, antidepressants take, I already read that. Oops. So Adderall in college students. So the idea is that if you use Adderall and you don't have ADHD, is that you'll have an abnormal amounts of energy to accomplish more tasks in studying or homework and enhance your grades on your exams. So for college students, college years are usually one of experimentation. Psychoactive drugs and use and recreational stimulants use is highest among 18 to 25-year-olds, and 70% of the students who used Adderall specifically for academic advancement. And continued, 28% of prescribed users and 50% of non-prescribed users reporting that obtaining a stimulant medications was easy to somewhat easy in college, And also, college students are more likely to divert stimulants than any other abusable medication. So the problem with abusing alcohol. So Adderall comes in different colors depending on the concentration. When students are being sold Adderall, oftentimes the pills are not given in a bottle. And as we can see here, depending on the prescription, Adderall can look completely different. And so for an untrained eye or someone not receiving this drug from a professional, you can't actually know if you're actually receiving Adderall or some other kind of drug. So does Adderall enhance your performance? So as studied by Kouzakos, Pendina, and Ogilvy, and so these are 3 PhD psychologist students that researched the effects of Adderall when used illicitly, and they found that the use of non-prescribed Adderall among college students, so their results showed that the average for students who used Adderall for academic advancement had lower GPAs, and it should also be noted that these students with generally higher GPAs are roughly half as likely to use psychostimulant medication as those having lower GPAs. So, in another study, investigators Lisa Wyant, professor of psychology, and George and Ann Ryan, both with URIs, and Tara White, assistant professor of research in behavioral and social sciences at Brown, found similar results. And so, to sum it up quickly, Adderall did not improve reading comprehension or fluency, and it impaired working memory for those using it illicitly. So, continued, there was a double-blind study done on which both the researchers and the participants did not know who was receiving the placebo. In total, there was 13 participants, so each student received Adderall in one session and the placebo in the other. This allowed the researchers to see the effects of the medication versus the placebo in individuals and across the group. So they're subjecting themselves to psychological effects but did not appear to be enhancing their neurocognition. So, in conclusion, as we have seen and answered, the performance of college students does not get better based on whether you use Adderall or not. If you're using it illicitly, you're doing so in vain, and you should not do it.